I just am going to end with a little bit of context about Visible Network Labs, and why we kind of believe that we want to, and hope that we can be a thought leader in this area and a conversation platform. So I'll just let you know a little bit about VNL. You've heard this now a few times, but our goal is to make invisible networks visible. We are a social enterprise dedicated to strengthening social connectedness, and we really do envision a world where everyone has the social support that they need, and our mission is to make that happen. We do that by providing trainings and workshops. We do focus on technology-based solutions, and particularly mapping and measurement tools. But our hope is that we're providing opportunities for collaborative innovation by translating data to practice. We work with folks all over the country and now actually all over the world. So we have projects throughout 10 different countries at the moment, and then all over the country. But we also have users who use our platform who we don't interact with at all. Oops, sorry, I didn't realize this was on an animation. These are some of our partners that we work with. And we're just really proud of not only our relationships with them, but that these folks have come to us to say, we're really trying to solve issues of social connectedness, actually at the systems level or the individual level. There's a lot more that we work with, but it's something that a lot of people are paying attention to. We do use network science as a unique lens on social connectedness. This is a picture we drew one day to kind of say, what if we could solve all the problems? What would it look like? This is kind of our way of showing, the people who, the way that we look at social connectedness, for example, at the individual level, community level, the carrying capacity of whole states and larger regions to address these issues, and then even the policy and, national solutions that are coming out to help us solve these problems. It's really not any one of these, it's the combination of all of these levels and work together of thousands and thousands of partners across the world that I think is the only way that we'll really be able to solve this issue. We do this at Visible Network Labs through our partner platform. We have a platform called the CPRM, the Community Relationship it's Community Partner Relationship Management System that allows us to track networks at the systems level. So for example, how organizations are working together to solve these big problems. But we also run Partner Me, which is a way to screen a person on their personal support networks, make that visible for a provider, and then connect them to care based on the things that we learn about. So in the case of my mom, for example, had that oncologist had a tool like this, he might have given it to her and really was, been able to see how complicated and at risk that she was had she been able to provide this kind of information to him. Last thing I thought I would mention is our VNL values, beliefs, and philosophies about social connectedness. Our work is really based on a strengths-based approach. And at VNL, we really honor a person's personal strengths and the assets they bring to their own care. And our work is working to leverage their strengths first and then fill the gaps. So we've done a lot of research over decades now, and we learned so much all the time. We're constantly learning about this topic, but things that we have found is that people's social support systems are mostly informal. They want to help themselves. They prefer to build personal resiliency over using system supports. But that people have personal assets that they bring to their own care, and that we often, we fail to, we rarely ask them about them, and we often fail to leverage them when trying to help. So what we're trying to do here at VNL is really use these learnings that we have about social connectedness to build solutions. We do this work in several different areas, and we hope to bring that throughout the year to this conversation. I've mentioned our work with adolescent social support and the Annie Casey Foundation, but we also do work, for example, on social isolation with Recetas, which is a 7-country project working on social isolation and nature-based prescribing as a solution. We work with, my logos are a little messed up, but suicide prevention for veterans, mental health, behavioral health with some of our mental health centers in Colorado, and some work on education and school systems with partners like the Bill and Melinda Gates Foundation. So I'm just going to end with reminding you that we're going to go through all of these topics, we hope, in great detail in the future. And I cannot say enough, please connect with us and let us know what you want to hear. If you want to talk about these things, we're really just trying to build a big community right now of folks who can do this together with us.